All right, everyone. My name is Andrew Niekamp. We're at SIR 2024, and I'm here with Dr. Moreno from Yale. And today we're going to be discussing some issues surrounding VTE. So, Angelo, I guess my first question for you is, and I know you're going to be presenting this at SIR, but the 2-year outcomes of the CLOUT registry. Tell us about your experience with that, what you've kind of seen from it, and do you think it's translatable to general practice and interventional radiology?
Yeah, that's a great question. I mean, when I first started using the CLOUT retriever, there were people in my practice that were like, oh, you may be a little too aggressive treating these patients. It's a new device. There's no data on there. But I was able to see the rapid improvement in patient symptoms compared to the other types of treatments I was doing. And so now we have this 2-year data that will put that to rest because it's really great data. It's safe. It's effective. And it shows that this is translatable to people throughout the community and throughout the United States.
Yeah, so in my practice, I actually found the exact same thing, and I was really excited when I saw the data and I saw that this was long-term improvements. But with the 2-year, I guess, which parts of that data set really stuck out to you the most and really made the biggest impact on you and how it's going to shape your practice going forward?
Yeah, so aside from the safety data, which was great, for me, it was very important that we were getting almost 90% of complete thrombus removal.
Right.
All right, so I'm a big believer in open vein theory, and I think if you leave CLOUT behind long-term, that's going to cause more problems. It's going to increase the risk of rethrombosis and PTS. So the fact that we have a device now that's able to remove the clot in its entirety, and it doesn't matter if it's acute, subacute, or chronic clot, it works across all subgroups.
Right.
That's huge.
Yeah, I think that's one of the best things about the CLOUT device is, out of chronic clot, I really do believe it's the only device on the market that can really get rid of full chronic clot. And there's been this new renewal on kind of the investigation on full thrombus removal, wall-to-wall thrombus removal, and it sounds like you buy into that too. And I think it's important that this is a data set that really shows the importance of complete thrombus removal.
Yeah.
Tell about the PTS rates at 2 years.
Yeah, so very strong data in PTS rates where we see that, more than 90% of patients had no moderate to severe PTS symptoms, which is a really, really great number there. Right. And when you compare it to other studies that haven't been done, that's a lot lower than the other studies out there. So
I think I saw from your presentation that there's going to be, it's out of all the studies that have been done, ATTRACT and CABA, this has the best PTS.
Just has the best long-term data.
Right. And then tell us about flow at 2 years.
Yeah, so at 2 years, we're seeing sustained flow throughout and compressibility over 90%. And that also was a testament to the open vein theory and that the CLOUT retriever is safe and effective, right? Because if, people talk about, it damages valves or it causes the increase in rethrombosis potentially because of endothelial wall damage, and we're just not seeing that.
Exactly.
The rethrombosis rate in CLOUT is 8%. And that's on the lower end of anything in published literature.
Right.
So, the fact that people say, is it safe? I think we have an answer now that it's definitely safe, it's effective, and we're seeing great results.
Right. And what are your reviews on the, potential damage to valves? There's been a lot of studies done and nothing's really shown it yet, but and somehow that keeps percolating.
I know. In my practice, I haven't seen it. I have plenty of cases on IVUS where we see that there's clot filling the vein, and then we take the clot out, and then the valves are functional again.
Right.
And if you don't remove the clot, that's definitely going to damage the vein.
I personally, during mine, I've never seen any. I actually see the valves functioning on venography right after I do the procedure. So, and again, it's been extensively studied, and there's been no evidence about any.
I think now we've had over 60,000 CLOUT retriever cases.
Right.
And we would see some kind of signal if it was causing damage.
Right. And I think what's really interesting too about the CLOUT registry, and I'd like for you to speak to this too, is the things that I really cared about as a physician was how is it actually affecting the patient? We have a lot of stats about flow, and we have a lot of stats about thrombus removal and what the age of the thrombus was, but none of that really matters unless the patient feels better, right? And until I got into practice, I didn't realize severe and moderate PTS is just debilitating.
Oh, yeah.
So do you think that's going to be something that's going to really impact people's view of treating DVT more aggressively? Or do you think we need more studies that are going to be able to kind of tip the needle so that we can address this patient population?
Yeah, I think it will. In my practice and in my surrounding area, it has, as the word has gone out, these patients feel much better, much quicker.
Yeah.
Right. So, and now we know that long term it holds up.
Right.
So we know when we look at the matched data sets to the other studies out there, and we look at the anticoagulation arms, say in ATTRACT, and the thrombolysis arms, the results are better with thrombectomy. Right? We'll know for sure now once we have DEFIANCE.
Right. So tell me a little bit about DEFIANCE for people who don't know what that is.
Yeah, so DEFIANCE is a randomized control trial, which is looking at anticoagulation versus mechanical thrombectomy with CLOUT treatment. And it's a win ratio, 1-to-1, randomized. We're looking at 300 patients,
right.
Follow up to 6 months. Yeah. And I think that's going to give us a lot of answers that the people who are skeptic will be looking for.
Yeah, it's exciting. It's going to be the first randomized controlled trial in the DVT space since ATTRACT. So I'm really excited to see that data. And I think that's a bold task to take on for the company, but I think with what we've seen, I think we're pretty confident that we're going to see the outcomes are going to be better than mechanical thrombectomy.